Yeah, absolutely. We're just talking about how much we have to talk about here because she's a wealth of knowledge. And thank you, Theo. I hope we get some reprieve from this heat. And speaking of reprieve from pain and illness, you are our girl, Dr. Lela, and
Yes.
this is amazing. We were talking about
Vitamin C.
Vitamin C.
And then just checking, because when you know, people don't like taking vitamin C because it causes stomach upset and diarrhea, but it only does that when you're taking more than the body needs. But how would you know without testing?
Yeah.
So, and most commonly, like things like Emergency, it only has 1,000 milligram per packet. This one is 4,000 milligrams per
Wow.
scoop.
Oh my
And I
gosh.
usually have people take up to 3 scoops if they can handle it. Like I said, when the body is going through something where it needs more antioxidant effect, it can use it.
Yes.
And then the only way you'd know if you have too much is if you come and get somebody to test it. It doesn't have to be me. You can go
Right.
to any functional medicine provider, or you get the symptoms and then you back off. And then you'll just pee it out.
Oh, interesting. Well, that's
Yeah.
good to know too. I think it's one of my biggest fears is I'm going to get one of these supplements and just like, you know,
Yeah,
could take way too
overdose.
much.
Yeah,
OD
yeah.
on
It would just,
Yeah.
the body will just eliminate it.
That's fantastic.
Yeah.
And then we want to move on to
The B vitamins. Okay, I
love
like
B
this one
vitamins.
because it has a combination of B12, B6, and also folic acid. And the good thing is it's all in methylated form. Why is that good? Because a lot of people have a genetic defect called MTHFR. MTHFR. It's a methylation defect, and you need methylation for the liver to do the detox function.
Really?
So in people that
interesting.
have that genetic defect, they can't methylate, and then the liver has trouble making things water soluble so we can excrete it. So we just do methylated and for all our patients because testing is expensive and it's not harmful to take a methylated form. If your body is able to methylate, extra methylation is not a problem. But I also like it because it has B6, which is also another of those things which we need in conversion of amino acid into neurotransmitters. So I like to get things that have several things together. So you get away with one pill having so many different things
That's
instead of taking
fantastic.
5 different bottles.
That's incredible. I love that. That's awesome. Absolutely.
All right, the next one is vitamin D. And that is very controversial because in the functional medicine world, we like the levels to be a little higher, like between 80 to 100. And you wouldn't believe it, at least a third of the patients I see, vitamin D level is in single digits.
Really?
Yeah, so
That makes a lot of sense.
yeah, and
That's
vitamin
interesting.
D is not just for bone health. It also has cardioprotective effects. It has antioxidant effects, and there's research on all of this. So most people, if they're seeing me for the first time, they get scared like, oh, my doctor told me not to take so much vitamin D because it causes problems. And that is true, Amber. What it does is if you take too much vitamin C, it causes calcium deposits in your blood vessels.
Oh, interesting.
We don't want that. That's why I use this formula. It has vitamin K. Vitamin K prevents that calcium deposition in the blood vessel. So the calcium is deposited in the bone, which is where we want it.
That is interesting.
And this also has vitamin A, which helps the absorption of the D from the gut.
Wow.
So it's just to say again, like I like things that are made in nice combinations. So you're not taking a bottle of D and a bottle of K. Again, we check levels and we try to push it high. We do it safely because we use things that work well together.
I love that. That is so interesting. And,
Yeah.
we all think about our vitamins, a multivitamin. We think, oh, good enough. What are some of the symptoms of having low vitamin D?
Actually, no symptoms.
Really?
Yeah, no. And people say,
Wow.
hey, it's summertime, I'm going to go out in the sun and I'll have enough vitamin D. That's not true for many reasons. If you're using sunscreen, you're not going to absorb.
Really?
Yeah, and if you're fully clothed, you're not going to
Wow.
absorb much. So unless you plan on sunbathing on your rooftop without sunscreen, you should be taking vitamin D.
That is so interesting. I've never thought about that before. Yeah, because you head outside and the first thing probably that comes out of your mouth is, I'm going to, go for a walk and get some vitamin D. And
Right.
you might not.
No, unless you're walking around in your fenced-in yard.
Yeah, exactly. Well, where can people find you online, go visit you, and give you a call because you know so much, and there's so many of us that struggle and don't know where to go, and we're so thankful to have you
Right,
here.
so they can always reach out to us. On the website, there's a button where they can get a free 15-minute consult. I'm happy to talk to anybody, answer any questions. I guess you'll have to have me back to finish the rest.
All right, we're going to finish this next time. You can catch her not this Wednesday, but the next, and we'll talk all about the supplements. Yeah,
yes.
I'm excited because this is absolutely huge. Thank you so much for joining me today.
Thank you for
I
having
love
me.
having you. Absolutely.